Hi, everyone. I am so excited. Today we are going to be talking about the impact of sleep on your mental health. I have an amazing guest that is coming on. I'm going to take a second and invite him. I've got Dr. Creado. Let's see, peak sleep performance. Let's see, he's not there. Oh, whoops, maybe because I can't see him. Hold on, give me 1 second here. I'm trying to invite him. There he is. There he is. Okay. Dr. Creado, who's one of our amazing doctors at Amen Clinics, and he is an amazing sleep doctor. There he is. Hello, Dr. Creado.
Hi, Tana. It's so great to see you.
You too. I'm always so happy when you join me. You are just a wealth of knowledge, besides the fact that I just love talking to you. So thank you so much for doing this.
Likewise, my pleasure.
How are you?
I've been terrific. I'm actually in New Orleans for
Oh,
the psychiatric conference. It's been going great.
well, how fun. That's so great. Great music, great food.
Exactly.
That's awesome.
Great life
So I want to
music.
take 1 second to introduce you, if that's okay.
Yes.
So I do want to say, I want to brag for a minute because Dr. Creado is one of our doctors, and I just think he's amazing. But I do want to say that Dr. Creado is a double board certified sleep medicine doctor and a psychiatrist for Amen Clinics. He sees patients for brain health, mental health problems, and sleep problems. He's also on the board of directors of the International Society for Sports Psychiatry and is affiliated with the PGA Tour in Europe, the NBA Players Association, the Australian Football League, and the U.S. Olympic and Paralympic Committee. Wow, that's so awesome. So you do so much. I don't want to go through the entire thing because I actually want to take some time to talk to you and respect your time, but you do so many cool things. You're the author of the book, Peak Sleep Performance for Athletes, the cutting edge sleep science that'll guarantee a competitive advantage, debuted #1 in sports medicine on Amazon. And one thing I love, because I actually talk to you a lot about your course on sleep, you actually host a course that's available on Amen University that's all about sleep. That is actually a course that Daniel and I really love. So it's overcoming insomnia, correct?
That's correct. Yeah, it
Yeah.
has a complete protocol there, lifetime access for anyone who gets it, and it kind of guides you in terms of exactly where your sleep is falling off and what to do about it, specific tangible steps.
I love it. So one thing I want to start off saying, Dr. Creado, because when we've talked to you extensively on our podcast, I've had live chats with you. One thing you said, because I love everything you say, it's amazing, but you said one thing that I didn't trust and didn't believe at first, and it was because I was taking fairly high dose melatonin. And you suggested that I lower the dose. You thought that I should take a lower dose of melatonin. I'm like, there's no way, never going to sleep, never going to happen, because I have so much trouble sleeping because of my thyroid issues. And so I literally take a tiny dose of melatonin now and sleep so much better. And I never thought it was possible. How weird is that? I just didn't trust it. So thank you.
You're welcome, Tana. And that's a misconception a lot of people have, which is why we're doing these kinds of things to help people know exactly what to do about their sleep, including melatonin.
Excellent. So we have a lot of questions. Is there something you'd like to start off saying before we get to questions?
I will say that sleep has been a major problem in this country and other countries all over the world for many years.
Mm-hmm.
But post-COVID, it's now even worse. So
Absolutely.
in 2019, around 70 million Americans had sleep problems. Now it's over 200 million. So around 3/4 of us are now having severe sleep problems because that's so tightly linked with mental health issues.
Absolutely. It's so interesting. You know, one thing, so I've got a list of questions here, but one thing, I'm going to start off with a question that I have for you, because it's really interesting. I became super fascinated with this thing called ACE scores, adverse childhood experiences. I really dug into it as someone who was super sick as a kid, super sick as an adult, had 10 medical surgeries, and linking it to adverse childhood experiences and childhood trauma. But one thing I learned through really digging into all of this, how not only it affects your health and your disease process, it affects your ability to sleep, because that cortisol gets turned on so early on in your childhood. And it affects the developing brain. So can you talk to us about how trauma affects sleep?
Trauma affects sleep profoundly. If I had to ask you about your earliest memory ever, it's going to be an emotional memory. Our emotional centers in the brain that we see and the SPECT imaging that we do as well develop first, and our rational brains lag behind. The frontal lobes, as we know, finish fully developing in our late 20s. So therefore, we have all this emotional circuitry in place, and then trauma and an inability to rationally cope with it effectively because the frontal lobes have not fully developed yet. So trauma affects sleep profoundly because trauma means anxiety. Anxiety is danger mode, and sleeping is the most vulnerable thing we can do. So if you think about conditions like PTSD, for example, there's nightmares, there's flashbacks, there's hypervigilance. So you're always on guard, looking out to protect yourself because you've been traumatized. And that's incompatible with sleep. And so early on, our brains may not get the training that they need in terms of effective sleep. Also, as you rightly said, the cortisol levels go up, the stress hormone levels go up. And interestingly enough, the less sleep we get, the higher the cortisol levels. So then it becomes a vicious cycle that sabotages our sleep and is very hard to correct.
So interesting. And so but one thing I always want people to know, Dr. Creado's course this is why we did this. And it's why it's on Amen University. It's why it's one of the courses that we have, because it's such an important component to getting your mental health really, really good is sleep, right? And just because you grew up in trauma, just because you have trouble sleeping now and you had trauma in the past, or you have current trauma, does not mean your history is your destiny. It doesn't mean that you can't change it. And that's really the exciting part, right?
Completely. Sleep is a modifiable risk factor and is linked to the top 10 causes of death in the world: obesity, heart attacks, strokes, dementia, cancers, diabetes, hypertension. But it's also linked to every major category of psychiatric illness. But the golden opportunity is that it is modifiable if you know what you need to do. So your sleep improves, your quality of life improves, your mental health improves, and your disease burden will also reduce.
Absolutely. So some people are like me, where they're really high maintenance. Like I'm a sleep princess. I'm a super high maintenance sleeper. I travel with my own pillow. I travel with my sleep supplements. I travel with an eye mask and earplugs. Like I'm not kidding about this, right?
Amazing. God bless. Absolutely.
Yeah, my
That's the way
room
to
has
do
to
it.
be at 68 to 69 degrees. Like, I'm not kidding about it. I will only stay at hotels that have blackout shades. I'm sort of not joking, right? So there are some people like me. And then there are people like Daniel who irritate me to no end because he lays down and in 30 seconds he's out. Lights can be on. It could be 90 degrees in the room. Does not matter. There could be noise. He's gone. And so it's so unfair. It's like it's just so unfair. But, it doesn't matter. You have to work with what you have.
Absolutely. And maybe I need to talk to Daniel after this conversation because there's research to show that your quality of sleep will be impacted by 1/3 or half in terms of quality of sleep if there's even a little light coming into through the shades, a chink in the curtain, because you're not going to get the proper regulation of your deep and dream sleep. So anything that's stimulating, noise, light, even if you think you're getting sleep, good sleep, you could get better sleep that you're missing out on. So you could consolidate quality sleep in the same amount of time you're allowing yourself to sleep.
Well, the truth is, he probably gets of me because I keep everything dark and cool. But if anything's going to wake him up, it's me because I'm so jealous. I just want to wake him up. But I'm like, nobody should be able to just go to sleep that fast. That's just not right. But
it's a blessing.
Yeah, it's crazy. So people are asking how we can improve our uninterrupted sleep. I think you're really already touching on that. A lot of the stuff I'm talking about now, I've gotten from you from our conversations, temperature, reducing my melatonin actually. So taking small doses of melatonin. You helped create our new supplement for sleep. So that was really important. And it was a much smaller dose of melatonin. And for the longest time, I would not take it because I'm like, nope, I have to have like this like much higher dose of melatonin. And when I finally gave up that thought, I thought, is this true or is it one of my aunts? Is it a thought that I have that I can't sleep without my melatonin? And I remember forgetting it one time when we went on a trip, and I'm like, oh no, I went into full panic mode. Like, I'm not going to sleep. And I thought, okay, now I'm going to challenge my own thoughts. And believe it or not, I've been sleeping so much better since, right? So I
Yeah.
think this list that you give people, like, what are a couple of your favorite hacks to give people uninterrupted sleep?
The first thing is to have a fixed wake up time every day of the week, even if it's a weekend day, because that kind of locks in your circadian rhythm. You know, the melatonin and the cortisol that we spoke about. That's the circadian rhythm. Locking in your sleep, your wake up time is key, and then allowing yourself. Most of us adults need around 7.5 hours of sleep, or 5 sleep cycles of 90 minutes each. So if you're counting backwards, if you're waking up at 7:30 in the morning, make sure you're hopefully asleep by 12 a.m., which means from 11 p.m., avoid bright lights, dim the lights at home. Let's make it all romantic for you and your partners, right? Even wearing sunglasses if need be. Maybe some meditation, a warm shower, a winding down routine. You mentioned the ants, right? There, you can do a daily download and write down the things that you tend to worry about, or things you're anticipating doing the next day. So you do those all before you get into bed, so that you don't associate the bed with those things. And you already spoke about the bedroom environment. You're absolutely right on every one of those things you mentioned. Locking in your wake up time, winding down before bed are two of the most important factors there. And the sleep supplement that you mentioned, it's called Put Me to Sleep. It has low dose melatonin. It also has magnesium to stabilize your deep sleep, GABA for the dream sleep, 5-HTP, and B6, which help your brain make more serotonin to reduce the ants and allow you to get the quality sleep that you need rather than waking up miserable or snowed. A lot of those over-the-counter sleep medicines are just bad news, Tana.
Right.
They can increase your restless leg syndrome, increase your risk of dementia because they block acetylcholine. Just bad news. But healthier habits, supplements to support those habits are the way to go.
I want to repeat something you said, because this is something I learned the hard way. I was taking Benadryl type medication for sleep. It's so bad for your brain. When I learned that, I didn't realize how bad it was. I would take it when I travel, because we travel so much across time zones. I'm like, oh, this is going to help me get on the new time zone, like, switch time zones really quickly if I can just take something and go to sleep and then wake up in the morning. I didn't know how bad it was for you. So now instead what I do is I make sure, let's just say I'm going to the East Coast. I make sure I take a super early morning flight, which forces me to get up early because on the East Coast it's 3 hours later. I'll do that and then stick with my normal routine. So yeah, maybe I'm going to be tired that day, but that means I'll go to bed according to a normal hour on the East Coast. So I try to travel according to the time that it is, even if it means getting up what feels like in the middle of the night for me, because it helps me get on track faster. But
And
yeah, I wanted to just
I
reiterate
love
that.
that.
Yeah.
I love that because there's a separate people, there's athletes I work with, and some of my patients who specifically ask for consultation on, okay, I'm going to Jordan or the Middle East or Africa, and I'm going to be several time zones ahead. How do I shift quickly? How do I arrive at peak performance? How do I arrive refreshed? How do I deal with jet lag? Because your brain takes around 1 day to
Right.
adjust for every hour of sleep difference. But I do that for my patients within 48 to 72 hours. Boom.
Oh, wow.
So that's easy. So next time you're traveling, Tana, let me know.
Well, I'm
Give me those
traveling. I'm going to
details.
Italy in 2 weeks. So what do I do?
Email me and I'll tell you exactly what to do. Give me some flight details, the timings, and the duration you're going to be there. I'll figure it out for you.
Okay, well then I'll post it for people because I know people want to know that because the summer's coming. So I'm going to post it for our people watching right now, what to do for switching time zones. I want to be respectful of your time. I'm not sure how quickly I have to get off, but I think that's most of our questions. You already answered about magnesium. That was one of the questions. And I think the last one, and if you don't have time to answer now, then we can either do another live chat or you can email, like I'll email you and you can email me and I'll put it on here. The last one
I
was
have as
how
much
do you
time
get
as
off
you need. I've blocked off enough time. We can do 30 minutes more if you have the time.
Oh,
So
you're awesome.
I'm there.
Someone asked how to get off of medication.
It depends on what medication it is, right? So, and whether the medication has a purpose in their lives, whether it's a psychiatric medication or
They
pure
said
sleep
sleep
medication.
medication, so I don't know which sleep medication. I don't know if it's
Right.
benzo.
So there's exactly right. So I'm not going to tell someone just get off their benzodiazepine right away. It could cause withdrawal seizures. So please don't just stop your medication without consulting a doctor. But if it is a benzodiazepine, there's certain medications that can reduce the chance of withdrawals, and slowly tapering or reducing that medication over several months would be the way to go under the guidance of a doctor. Now, there are a lot of sleep medications or other medications used off-label for psychiatric purposes, like some of the antipsychotic medications, which can be helpful for sleep, may also be needed for people who have schizophrenia or bipolar disorder. So it depends on the kind of medication, and you can always kind of balance that out as you're tapering that medicine with helpful supplements like Put Me to Sleep, or another medication which is less side effects, less chances of withdrawal, to kind of cushion the withdrawal while you're implementing a healthy sleep protocol like we have in my book, Peak Sleep Performance, or like in the Overcoming Insomnia video series that we have for our patients as a resource.
I love that. And I do want to, one thing I want to say to people is it really is a good idea to have someone help you. If you've got sleep problems, definitely if you have medicine, if you're trying to get off that, don't do it by yourself. But if you have sleep problems at all, and I'll tell you why, because people think, oh, I'm just going to play with supplements. And even I did that. I mean, how silly, right? But I remember thinking, oh, I want to like sleep better. And I took some 5-HTP and I literally felt like I was high. Like I'm walking through mud and I couldn't figure it out. I'm like, people love this stuff. They like take it all the time. It doesn't work for me. GABA, it's like magic. It's like amazing. A little bit of GABA, a little bit of magnesium, and a little bit of melatonin. And I'm like, it's magical. But I can't take 5-HTP. It just doesn't work for my brain type. So really important that you understand, you know, there are things you can do for your brain type that make you better. There are things you can do that make you worse. But someone like Dr. Creado will help guide you for your specific type and what's going on in your life and your disease processes and things like that. So
absolutely, one size doesn't fit all. It depends on the quantity of the supplement you're taking, the timing of the supplement, where you're sourcing it. There's a lot of companies that don't have good quality products, really. BrainMD, that's why, you know, we work together on that Putting Me Sleep, because we know about the quality we're getting, and then it's dose dependent, timing dependent, and the individual brain, as you said. So I do sleep consultations at Amen clinics, right? And I see patients from all over the country. I'm happy to help anyone who needs that guidance and support.
yeah, and you're so great with that. Someone asked how much sleep someone should, like people should get.
Okay, so sleep is the major recovery tool known to humanity, and most adults need 7.5 hours of sleep. There's a small percentage of 1% of people who need less than 6 hours of sleep. They're called short sleepers. It's a genetic issue. Really lucky for them, maybe. But other people may need more sleep, like my elite athletes need 9 hours or 10.5 hours or 12 hours of sleep. Roger Federer gets 12 hours of sleep in a 24-hour period because they're training so hard. So therefore, you need more sleep as a recovery tool. So teenagers need more sleep, around 9 hours of sleep. Children may need 9 or 10, 11 hours of sleep. So the younger you are, the more sleep you need, because you're growing, your brain is growing, you need everything to work properly. And then adults, you know, in your mid-20s and beyond, typically need around 7.5 hours of sleep.
For whatever reason, Daniel needs about 7, and I need about 8 to 8.5, and I don't know why. It's just how I feel good. So
absolutely.
One person asked if your partner snores, should you sleep in another room? And I'm just going to say, so we have in our house, Daniel sometimes snores, like and it's weird. It's not always. It's like, especially when I say he slays dragons. So if he's got a lot on his mind, if he has a lot going on at work, if we travel a lot, all of a sudden he starts slaying dragons. Not only does he snore, but he'll start kicking his feet. And I'm like, okay, what is going on? It's like, why are you kicking your feet in the middle of the night? He doesn't do it all the time. So we have a separate room set up, and because we care about each other and we know how important sleep is, not only for our health, but to our relationship. So he'll get up and go in the other room. If one of us is sick, or if one of us is, if he's snoring, one of us will go in the other room. And we do that, probably end up doing that once or twice a month. But it's important to us because we actually are happier together as a couple. So.
Oh, completely agree with you. And that's one thing you can do. In the sleep medicine world, we call it a temporary sleep divorce. right? When you sleep in separate rooms. But if your partner is snoring, maybe your partner should be screened for sleep apnea, right? Sleep apnea is devastating the brain, direct links with cancer, dementia, heart attacks, strokes, sudden death. So make sure your partner has been screened for sleep apnea. And if you can't move to a separate room, then maybe you should be wearing earplugs or something, right? If you don't have the space to sleep in another room. But also remember this, if you are drinking alcohol, it's going to worsen your snoring or sleep
Absolutely.
apnea. If you're on your back, it's going to worsen that as well. Some people use a bed wedge you could get on Amazon or something and place it under the mattress so that you have a little angle, maybe a 30-degree angle, that's going to reduce the severity of your snoring right off the bat. You might want to go to an ENT doctor, right? Kids may have adenoids or tonsils that need to be looked at or removed. And if you have a collapsing nose, that may be the source of the snoring, and a simple strip that prevents the collapse of your nose may be helpful for you. So snoring needs to be looked at.
Love that. We have so many questions. I feel like we need to do part 2.
Yes.
So if you're up for that, I would love to do part 2.
Done.
Would be great. So
You
people are
let me
asking about foods, and they're asking about, I mean, all kinds of things, restless leg, and I mean, we could go on and on. So I think we should do another. So for anybody who didn't get their questions answered, please know we will do another one. Dr. Creado has a course on Amen Clinics on Amen University, and he's available for sleep consultations. But we'll have him on again. I've had him on many times. I'll have him on again. We'll do a second part of this. Would that be okay with you?
Whenever you need, Tana, just give me the word. I'll be there for you.
Awesome. Thank you. And someone's asking if this is going to be recorded. It is. It's going to post right after we're done. I'm going to post it on my Instagram page. So it will be posted. Yes. Thank you so much, Dr. Creado.
Thank you, Tana. Pleasure.
Have so much fun. Enjoy the music. Enjoy the food. Be safe. And take care of yourself.
Likewise. Thank you.
Okay. Take care. Bye-bye.